just bringing more empowerment to women during pregnancy and birth. Hey y'all, welcome back to my channel, and if you're new here, welcome. I'm so excited that you clicked on this video because this is the first video in my new series entitled All Things Pregnancy Now That You're Pregnant. So this is going to be focused around research-based options that you have during pregnancy. I believe that there's so much of our Western medicine culture intertwined in birth and pregnancy, and women just don't know their options anymore. And it's totally fine if you want to follow the traditional path that your OB gives you, your midwife gives you, whoever your care provider is. But I just want to bring some awareness to the options in this series, and I don't want this to be opinionated. I just want to show you the options and make this very educational and a resource that I wish I had had when I was pregnant on my first child 3 years ago. So if you're new to my channel, I'm a mom of a 2.5-year-old and a 1-year-old, and I'm pregnant with baby number 3. We are right at 13 weeks here. If you missed my pregnancy announcement, it was a few videos back, so check that out if you want a very, very raw, realistic reaction. But anyways, what this video is just going to be focused on is things I wish I had known in my first pregnancy. I got pregnant within 3 weeks of being married, and just kind of jumped from that stage of wedding planning, newlywed life, right into planning for motherhood. And I was doing all the research and all the things, and I was just transitioning into more of a non-toxic holistic lifestyle, and I knew there were options out there, but I didn't really have resources to turn to, so I was always just searching things and pulling things from all over the place. So this video series is going to be more of a cumulative resource for you guys if you're wanting to take some of the more less traditional paths throughout your pregnancy and on into your birth and motherhood. So it's going to be broken up into segments, just starting out here today in the very first things that you have options on when you find out you're pregnant. So if you're watching this, I'm assuming that you're pregnant or know somebody that's pregnant, or maybe you just like watching pregnancy related videos. Honestly, to tell you all the truth, I like watching pregnancy related videos whether I'm pregnant at the time or not. If you are pregnant or just found out you're pregnant, I'm so excited for you. I wish you all the best in your pregnancy and hope that is everything you've wished and dreamed for. So I'm just going to present y'all some options today that you are going to have, that many women don't know about. I did not know about many of these things throughout my first pregnancy. Some of them I didn't even know about during my second pregnancy. I've just been learning about here in the beginning of this third pregnancy. So let's jump right in. If you are a mama, please share this with your friends. I want this to be just a really good resource for all moms, just to bring some more awareness to pregnancy and birth, besides what traditional medicine tells us that we have to do, what we have to not do, just to bring awareness. So let's jump right in. All right, first things first, this is going to be kind of obvious, but you have complete control over who you tell, when you tell them, how many people you tell, and how much you tell them. So I think our culture today, a lot of people wait until the end of the first trimester, which is totally fine. There's legitimate reasons to do that, but you don't have to do that. If you want the support of your family and friends from the very first or second week you find out, if that's your personality, tell them. This is your big news. You tell whoever you want in whatever way you want, as soon as you want. On the contrary, if you want to wait until the end of the first trimester or until the end of the third trimester, until you have the baby and just all of a sudden come out with a baby, and I think that's so cool. What a big surprise. It is totally up to you. You don't have to listen to what everybody else did or what your best friend did or what your mom did or your cousin did. Just whatever you're comfortable with, whatever your personality is comfortable with, tell who you want, when you want. All right, let's get into the more of the nitty-gritty ones now. The second one I wanted to talk to you about is your provider. You have the complete option of your provider. Many women have been going to an OB for several years. They've just been seeing that same OB provider for several years, and then all of a sudden they're pregnant, and that's the first person that they go to, which is great. It's great to have that option. It's great to have that relationship already built with that provider. But what I want to touch on is you have the complete option of if you want to keep that provider through your pregnancy, or if you want to seek out a new provider. A lot of times we've kind of just been going to an OB and we're just doing the normal things, and all of a sudden we're pregnant. Maybe we have some concerns or some things that we want to do differently in our pregnancy, and we mention those to our OB, and they may not be on board. They may be completely on board. There are definitely OBs that are so open to more natural options in birth and will support you along the way. But if they do not, if there's something that is just not jiving with you and that OB practitioner, it is completely okay to fire them. I know our society today, it's kind of odd to fire your doctor, especially one that you kind of have a good reputation with, but it is okay. They work for you. You are paying them, or your insurance is paying them. You don't have to stick with somebody who's not going to allow you to do something or force you to do something that you're not comfortable with. So many times what might happen is you might mention something to your OB and they may tell you that they can't allow you to do that due to hospital or clinic policies, and that's really just them looking out for their job. I hate to say it, this is not my opinion or criticism to OBs or practitioners, but they're looking out for their job. They're regulated by the state, and if they go against a policy with their patients, they could potentially lose their job. So their best interest might not always be for you and your baby. They're gonna make it look like it is. I've been there, done that. I had a wonderful experience with an OB, but hospital policies still trump their relationship of how they want to care for you, and that's not my opinion, that's strictly fact. So if there's something you're not comfortable with that OB that they are suggesting that you do or suggesting that you can't do in birth or pregnancy or during labor, it is okay to fire them. Find someone who you are more comfortable with, or if everything in your state is very highly regulated, it is very, very regulated in Mississippi where we live, which is why we sought out midwife and home birth. If that is something you're comfortable with, again, I'm not trying to give my opinion here, just trying to state the facts. It is okay to seek out a new provider in the first week of pregnancy, third week of pregnancy, 8th week of pregnancy, 20th week of pregnancy, 38th week of pregnancy. It is okay to change providers. Yes, that's a little bit scary to change providers right there at the end of your pregnancy, but if there is just something that is not clicking, does not feel right with that provider, leave. Pregnancy hydration, so important. Always remineralize my water with sea salt and magnesium bicarbonate. Pure water these days is so stripped of nutrients and minerals. We need to remineralize our water, especially in pregnancy. Little side note there. The third topic I want to touch on here early in pregnancy is prenatals. This is another kind of controversial one that everyone is going to tell you need to get on prior to conception, all throughout pregnancy, and even after into the postpartum time. Totally fine. I just want you to know there are other options than taking just a generic prenatal from the grocery store, the drugstore, even when you get on Amazon, or even one that is highly, highly rated. There are very, very good whole food-based prenatals. But you do have the option. You don't have to take it if you don't want. I would highly recommend doing some research on this. I'll leave some resources down below for you guys to kind of kickstart your research on prenatals. The thing with prenatals is they are kind of like a generic one-size-fits-all. And as humans, we are not one size fits all, especially pregnant women. Pregnancies are all very, very different. Women lack different minerals, different nutritional deficiencies, and that prenatal is just kind of blanket coat everything. And another issue is a lot of the prenatals have synthetic vitamins in them, which puts a stress on our bodies to try to break down that synthetic vitamin. So be very cautious of the prenatal that you choose. Don't just choose the blanket one. It kind of hurts me that even some OBs still recommend the blanket, I'm not even going to mention some names, prenatals that are just sold over the counter, very cheap, very inexpensive, that are just not really the best for us during pregnancy. There are some high quality ones, but if you are kind of looking into other options, there are ways that you can supplement prenatals with food-based sources. If you're eating lots of grass-fed beef, high-quality eggs from pastured eggs, raw milk, bee pollen, bee honey, bee products from raw sources, raw cheese, if you're eating like that already and then supplementing with just a few other things, there's no need for a prenatal. So I definitely recommend you looking into some research on those. If you're more interested in that and what I personally do, check out some of my videos on what I eat in a day. I have one that just came out on my first trimester, what I eat. It also includes a little bit about supplements, and I have a full dedicated video coming out about what supplements I'm personally taking and why I take those. So be on the lookout for that if you're a little more interested in this food-based supplementation instead of just the blanket prenatal. So just want to touch on that. You don't have to take the prenatal that is recommended to you by your provider. There are other options, but I highly, highly encourage you to do your own very thorough research into that. You definitely don't want to be missing nutritional and mineral gaps for your baby, but there are other options than just the blanket coat prenatal. Not medical advice, just from my own research and what I have thoroughly looked into. Fourth option I wanted to touch on is the food list that pregnant women are given in that first trimester, and it's like the do's and the don'ts of what you should eat during pregnancy, what you should take during pregnancy, all the medications you can take, all the medications you should avoid, and it is totally your option if you want to follow those or not. With my first pregnancy, I followed them to a T. There was one on there about smoked or undercooked seafood, and my husband and I went out to a seafood place one time and had some smoked oyster dip. I had a few bites, got back in the car and referred to that list and almost had a panic attack because I had eaten smoked oyster dip during my pregnancy. I'm so afraid I was going to cause harm to my baby. So there are reasons for those foods to be on that list, especially if you do not know the sourcing of those foods. So there are diseases that can come about, such as salmonella, foodborne illnesses, and there is reason for that. They are kind of just to kind of cover their backs to make sure you cannot sue them. But if you have thoroughly researched foods and you know the sourcing of those foods, and they may be on that non-food list, but if you're comfortable eating them and you have seen good things from eating them, you don't have to follow that list to a T. I was very much of a stickler in my first pregnancy, not so much my second. If you've been around here for my third pregnancy, you've seen any of what I eat in the day videos, you will see some very non-traditional pregnancy foods that I eat, that I feel comfortable eating. So just know it's not a set in stone black and white list if you are knowing and research the sources of where your foods are coming from. But if you do not know where those things are coming from, definitely kind of stick to that list a little more strictly. Kind of just to open your eyes into researching, knowing more about your foods, where your foods are coming from, knowing your farmer, knowing your food, all of that. I've talked about that several times on this channel. It's something I'm actually really passionate about. Number 5, getting more into actually visiting your doctor, your OB, your midwife, is ultrasound. So at the very, very beginning, when you first go to your first visit, they're going to want to do a vaginal ultrasound. That is kind of a personal preference on doing research on ultrasounds, but you can definitely deny those. They're probably going to ask you why you are denying that. The main reason they're doing it is just to get a heartbeat, to listen to the heartbeat, and to kind of get an estimated due date. Earlier on, they can get that ultrasound and get that estimated due date, the more accurate it's going to be. And they're going to tell you that, and they're going to convince you that it's necessary. But let me tell you, it is not. If you're comfortable with it and you just really want to see your baby, it's your first pregnancy. I was the same way. I was very excited for that first ultrasound, but I just want you to be aware. Maybe do a little research into ultrasound heat before 13 weeks, and especially with brain development, you may change your mind on that. If you're early in your first trimester and you kind of just want peace of mind about the pregnancy, there are other options to hear that heartbeat. Doppler is one of them. As baby gets a little bigger, you can look into fetoscope, but again, you don't have to accept that vaginal ultrasound right there at the beginning of your pregnancy, or anytime throughout your pregnancy. I'll touch more on ultrasounds in another video as we progress through the pregnancy, but early on, those ultrasounds are completely up to your consent. For my first pregnancy, I strictly saw an OB. My second pregnancy, I saw an OB and a midwife. It was my first home birth, and I just kind of wanted the comfort of having both providers, which was beautiful. I absolutely loved that. I saw my OB about halfway through my pregnancy. But in that first visit, when I went in, I think it was 10 or 12 weeks, they really looked at me like I was crazy that I didn't want that first ultrasound, because it's just not a common thing. So if you're not comfortable with it, if you've done a little research on ultrasounds in those early weeks, you can definitely deny it. You may get some crazy looks, but it is your body autonomy. They work for you. Do what you feel comfortable with. Number 6, piggybacking right off that ultrasound option, you have the option of using Doppler or fetoscope instead. So those are 2 devices that midwives use because they don't have ultrasound machines, but your OB will also have, for sure, the Doppler. I don't know if they have fetoscopes, but you can definitely ask them. So early in pregnancy, I'd say around 9 to 12 weeks, the OB, the midwife, the provider can start listening to baby's heartbeat with the Doppler. Doppler is much less invasive than ultrasound as far as like the heat waves, but again, do your own research here, what you feel comfortable with, but you definitely have the option of using Doppler or fetoscope throughout your pregnancy if you are wanting to omit as many of those ultrasounds just to kind of check up on baby. Doppler will pick up heartbeat pretty early on. Fetoscope, however, will not pick up that heartbeat until closer to into the second trimester. I don't actually know the weeks there. My midwife kind of let me in on all of that and when we could start using fetoscope and when we would need to use Doppler. But that is another option if you don't want to have as many ultrasounds. You can also have Doppler monitoring during labor. I'll touch more on labor and options in labor as we progress throughout this series, but Doppler and fetoscope are another 2 options that you have early on in your pregnancy. Number 7 is screenings and genetic testing early on in pregnancy. And more specifically, I want to talk about the nuchal translucency screening test. It's called the NT test. Your OB will definitely talk to you about this. If you have a midwife, they may mention that you have the option to do this if you go into an OB clinic. But this is a screening that is done, I believe, anywhere from 11 to 13 weeks, maybe even earlier. It's basically meant to test for genetic problems in the baby. I think you can also find out the gender through this. There are ways to find out the gender very early on through blood testing and screenings like this. So This is, again, totally optional. You don't have to do this. And I think OBs are very, very good about letting you know the options for this. So what this does, mainly it checks for Down syndrome. And like I said, I think you can look at other genetic screenings for potential disorders and issues with the baby, as well as the gender. It's gonna come down to your own personal beliefs. If knowing something about your baby would not change the outcome of that pregnancy, you can definitely opt to skip this. If you would like to know these things, just have the peace of mind in the back of your head, go for it. But again, more screenings, more invasive, just one more thing for them to do to you that you can totally deny. This is not required. All of these are optional. So just wanted you to be aware of that. Just wanting to make y'all aware of these things that are going to be mentioned to at your clinic or OB office or midwife, and that you may have had no research on, but you just kind of want a friend here talking to you about these things, just from a least unbiased side as I possibly can give. If you've been on my channel, you kind of know my beliefs on some of these things, but I just really want this to be very informational. And number 8 is kind of very similar to number 7, but this is just any screenings, any blood work, any testing that they want to do to you. You don't have to consent to those. This even includes blood work. Even a midwife's office is going to ask you to do blood work, and there's sometimes like certain markers they're asking you to meet, or they're going to want you to meet for you to be able to continue on with their care, or they're going to want you to do some type of supplementation, and that's fine. But sometimes supplementation is not always necessary. The one I just want to mention quickly about is iron. Pregnant women should not be deficient in iron, no matter what a blood test says. Anemia is a big common one. I was diagnosed with anemia pretty much my entire life. Since learning much more about iron and iron absorption, I probably was not ever really anemic. Anemia, low iron, is usually due to a copper deficiency, which a lot of us are deficient in copper. When we are deficient in copper, our iron is not absorbed properly, which shows up as an iron deficiency. So many times women will show up as deficient in iron on a blood test and be asked to supplement with iron, usually a fortified iron, and it's just not the best. Again, do your research on that, on iron and copper supplementation, and if you want to just deny that blood work altogether, if you're very comfortable with how you eat, how you live, your toxic exposure, and you are not wanting to do all that blood work, you can opt out of it. A lot of times insurance doesn't always cover blood work, so if that's another thing you're concerned about and not really wanting to shell out the extra money for that, again, it's totally optional. This is your pregnancy, your body autonomy. The provider works for you. You don't have to accept anything that they ask you to do. And if they are going to require you to do it, you can definitely fire them and leave. So that is going to conclude my list for this video. Just wanted to touch on some of the things you'll encounter in that first trimester, in those early weeks and months of pregnancy that you may be asked about. And if you don't have any background on it, you're probably just going to blindly accept. And because that's what I did with my first pregnancy, I was trying my hardest to do research, but there were so many things I was researching and so many questions coming at me. It was just so many things at once. So I really want this to be very helpful to you guys. If there's something that I missed that you've been asked about, definitely leave it in the comments below or shoot me a direct message on Instagram. If I've had experience with it, I'll be glad to elaborate on it and kind of give you some background on it, what my experience was, some research I have on it. I just want this to be helpful to y'all and be a resource to you guys. Since I'm now in my 3rd pregnancy, I love this stuff. I love sharing about this stuff, just bringing more empowerment to women during pregnancy and birth, because I don't think that is talked about and brought as much attention to as it should be these days. I hope y'all will consider sticking around with me through this series, kind of as I progress through pregnancy and share these pregnancy options with y'all on into labor and after, into the postpartum time. So this is going to be a continued series. I'll probably have these videos coming out every 2 to 3 weeks. I don't want my entire channel to be filled with pregnancy content, because I know all of you guys are not pregnant, but if you are pregnant with me at this time, let me know in the comments below. I love knowing that some of my followers and friends on here are pregnant with me. I think that is just so special to be pregnant and sharing this special time together. So I'd love to connect more in the comments below or over on Instagram. So shoot me a message, shoot me a comment below with any questions, any concerns, anything I did not touch on or you want more elaboration on from this video, anything you want to know more specifically on for future videos in this series. And I can't wait to share more on this topic in this series, and I will see y'all in my next video.